Hello, everybody. Thank you for joining us today, being part of our 50th anniversary here at Big D's. It's because of each and every one of you that we're still here today. Thank you. We continue to appreciate your support. We always will. Hopefully you found some great deals. I see some baskets, some buckets, all kinds of things. So lots of fun things going on. Raffles. When you're done with the seminar today, please join us out in the parking lot. We do have free lunch. So go out, get yourself a hamburger or hot dog. If you're shopping throughout the store, we also have popcorn and refreshments here. So anything you'd like, any questions, just find one of us, ask. Lots of great pallet deals outside. And everyone, please help me in welcoming Dr. Corey Paradine. She's here to speak on poor performance today, so I will let you take it away, Dr. Paradine.
Hi, like she said, I'm Dr. Paradine. I'm at Cleveland Equine Clinic. So topic of today's talk, just a little bit weird there. I want to talk on poor performance outside of lameness. You know, we all know lameness can cause performance issues, very common, something that I'm sure every one of you have dealt with. But it's not always lameness when horses don't want to do their job. And so I wanted to talk about a few things that we think about when, you know, we have the complaint of my horse is not doing their job. So, you know, like I said, beyond lameness, poor attitude. A lot of times we hear the complaint of they won't go forward. And I'm sure all of you have experienced that as well and how frustrating that can be. Doesn't always mean they're limping, but a lot of times, especially if a horse was doing its job prior and now it all of a sudden doesn't want to, you know, that's a sign they're trying to tell us something, that something's not right. So this is just kind of a summary of what we're going to touch on, go a little bit more in depth. This is by no means all-inclusive. There are things that cause poor performance that are not on this list. This is just some of the more common things that we deal with, the more common things that we address, and kind of what we think of as you guys come to us with complaints of poor performance. So first up, gastric ulcers. You know, we know a lot more than we used to about gastric ulcers in horses. Super common. A lot of horses have them. It's something that I think owners are a lot more aware of. Absolutely can cause poor performance. You know, irritable, being girthy, decreased appetite, bad attitude under saddle. But one thing that I think people don't always think about is this last one, change in movement or change in their posture. So some of these horses, when their stomach hurts, they hold themselves differently. They guard their stomach. They don't want to be loose through their back. And that sometimes gets a little bit misconstrued as back pain because these horses don't want to round up. They don't want to carry themselves in a frame. And it's not always back pain. It's because they're guarding their stomach. It's because their stomach hurts. And if I'm sure everyone at some point in their life has had stomach pain, you get tightness through your stomach when your stomach hurts. And that changes how these horses move and how they perform. So I think that's important to keep in mind, that is a symptom as well. When we suspect ulcers, we really got to scope them. You know, there are times that we'll try treatment without scoping. I know scoping is a hassle. You have to fast them. No one likes to have a hungry horse in their barn. But you don't know the severity of ulcers. You don't know where the ulcers are unless you look. And the only way to do that is past the scope. They have to be fasted, like I mentioned, so we can see all parts of the stomach. But depending on where the ulcers are, changes treatment sometimes, changes the drugs we use, changes the duration of treatment. So, you know, you don't know until you look. Front row. So moving on, in ulcers, you know, treatment, there's different medications we use. Gastrogard is the most common. So Gastrogard is a proton pump inhibitor, so omeprazole. There's another type of proton pump inhibitor that I've started using a little bit. It's human Nexium. It's not a perfect drug for horses. These drugs have to be given on an empty stomach. And good luck trying to give pills to a horse on an empty stomach, especially when the pills are in a form that they are enteric coated, so that they can bypass the stomach acid. So that means you can't crush the pills, you can't grind them up. So it's a little bit of a challenge, not a perfect situation, but I think as time goes on, that this omeprazole, human Nexium, that is a drug that we're probably going to use a lot more. It's a little bit more potent than omeprazole. So I think that that is something we'll see, but it's another type of option along with Gastrogard. Sucralfate, that acts like a Band-Aid, makes horses feel better. So we use that a lot. Ulcer drugs are slow. We want horses to feel better as fast as we can. So we use sucralfate a lot for that reason. Misoprostol, that is a drug that promotes normal healing mechanisms in the stomach. I use that drug a lot for ulcers in the bottom part of the stomach, or pyloric ulcers. So this goes back to the scoping of knowing where your ulcers are. If a horse just has ulcers on the top part of the stomach, I'm not going to use omeprazole, I am going to use omeprazole. I'm not going to use misoprostol. Horse has ulcers in the bottom part of the stomach, most likely going to use misoprostol as well. But just because you fix horses' ulcers once doesn't mean that they can't get them again. A lot of people are aware of this. So we really need to think about long-term management with these horses, trying to minimize stress in their life. People are starting to talk about the 3 Fs: forage, friends, and freedom. Horses are made to be social creatures. They're made to be outside grazing and moving. The grazing part, forage, they need to have something in front of them to eat more or less all the time. So for long-term treatment of horses, we have to look at the whole picture for them to try and manage their ulcers. Supplements can be helpful for long-term management too. There's 1.5 million out there. I have some favorites, but I'm always open to, new ones that might come across the shelves. A lot of discussion on, a lot of people have preferences on one versus another. I don't think any of the supplements are perfect. I think they can help. They're not going to fix ulcers by themselves, but I think they can help for the long-term maintenance of these horses. Anyone have questions on ulcers? I know that's kind of a quick talk. I've done an entire talk on ulcers before, so there's a lot more information I'm not including. Yes?
Since you can't scope into the hindgut, how do you diagnose ulcers?
That's an excellent question. There is no good diagnostic for hindgut ulcers. We treat based on suspicion. So horses with certain clinical signs that we think are consistent, we might institute treatment. We don't even truly have a good feel for how often horses get hindgut ulcers. My personal opinion is it's probably not as often as some people think. I could be wrong. We don't have the research. I don't know. We also don't, because we can't truly diagnose it, we don't have great drugs for them either. I work a lot on the overall management of a horse. If I think they have hindgut issues, and I'm going to use hindgut issues in general as a general term, because I don't know if they have ulcers. I don't know if they just have inflammation. I will sometimes use a term. I think this horse might have an inflammatory bowel type syndrome. Again, I don't have the diagnostics for this. I'm going based off of the horse's presentation and clinical signs. But a lot of that for me is using management and feeding, changing feed, adjusting diet, using some supplements. There are some supplements I really like for hindgut issues. Succeed is one, Platinum GI is one. There's some others out there, but I kind of look at whole horse type situation. I don't know if that answers your question, but I don't think there's a perfect answer to that question. Anyone else on ulcers? So cervical pathology, so neck pain. This one I think is getting a lot of traction these days. A lot of people are talking about neck issues in horses. We are doing more diagnostics than we used to of necks in horses, whether that's radiographs, ultrasound. I'm jumping ahead a little bit. That's on the next slide. But this is really getting a lot more attention. So clinical signs of neck issues in horses include stiffness. It can be lameness. I know this talk is not about lameness, but neck issues, neck pathology can cause lameness sometimes. As I'll use this horse as an example. This is a CT scan of a horse. This joint right here is quite enlarged. And down here, this little space right there, it's bigger on this side, it's where nerve roots come out. And as you can imagine, this joint being so enlarged, you get impingement of that nerve root, and that can show as lameness. So, neck issues can cause lameness as well. Sometimes we see neurologic deficits. So your horse that doesn't quite know where their feet are, they're tripping, they're stumbling. I mentioned tripping there. Behavior is a question mark. I think this one's a little bit harder to gauge. Some of these horses I do think have behavioral issues or show behavioral issues under saddle, especially as we ask them to collect and round their neck and go in a frame. But I think that when there's so many other issues that can contribute to behavioral issues in horses, it is sometimes hard to have a direct connect. But I do think behavioral issues can absolutely be attributed to neck pain in horses. So going back to the diagnostics. So we are looking at these horses, looking at necks a lot more than we used to. Our physical exam, radiographs. Radiographs are great. We are x-raying horses' necks a lot more than we used to. Whether or not that is useful in a pre-purchase situation is a whole separate discussion. Radiographs miss a lot. When we radiograph a horse's neck, we take x-rays of a neck. It's a 2D image. Because of their size, we're really only getting a couple different views max. And so due to overlap and things like that, that can make it hard to interpret. So, is this enlargement clinically significant or not? Is this change in the neck, is it a problem or just an incidental finding? And also on radiographs, especially in the pre-purchase situation, is this, say, joint enlargement or facet enlargement going to be a problem for this horse in the future? And that's a really hard question to answer, really hard to predict, especially based off of one radiograph. CT scans are helping us a lot to answer those questions. This is a CT scan in our clinic that we have, so we can do it standing. Some CTs you do have to anesthetize them for. We do have the ability to do ours standing with just sedation. But the CT scan gives you a 3D image. So I'll go back real quick to this view. This radiograph, these are not the same horse, but you could have this radiograph. You see an enlarged facet here. This is closer to normal. It's mildly enlarged, but this is quite enlarged here. You don't know, is that enlargement going in towards the spinal cord? Is that enlargement going out? So it's not really affecting other significant structures. Is it going down and affecting those nerve roots? You don't know that from this radiograph. The CT scan, where you can look at different angles, this is more of a cross section of the neck. I can tell where this facet is going and what structures it might be impinging, like that nerve root. So the CT just gives us so much more information. And horses that present with neck issues, I really try to talk clients into considering a CT because we get so much more information. It just really is changing the game, I think, on neck issues in horses as we get more information. So treatments, treatments really depend on, if I have a CT scan, I can focus my treatments a little bit more. But they include, different types of injections. We can inject those joints. Sometimes we'll do a regional injection. I think sometimes the regional injections help those nerve roots a little bit more. Acupuncture can be very helpful. I think acupuncture is a great treatment anytime we have nerve pain. Shockwave therapy can be helpful. There are some surgeries that are coming about. Again, I'll go back to this horse. What they do is they go in and they remove some of that bone and clean out some of that space. So this horse was lame. because of that nerve root compression. He didn't have surgery, but he would be a good candidate for it. As you can imagine, that's a pretty involved surgery, pretty expensive. Only a few surgeons in the country are doing it right now. So it's not something that is commonly recommended, but it is an option. Physical therapy, I think physical therapy for these guys is really important. Excuse me. I think it can be really helpful. We'll touch on that more when we talk about backs next, but I do think that for long-term management of these horses, and this horse responded, we did some injections with that horse too, but he responded really well to some really persistent physical therapy that the trainer did. So lots of different options, but we guess a little bit when we only have a radiograph to look at. When we have the CT, we can very much titrate our recommended treatment plan. That being said, like anyone else, some horses are going to respond better to one type of treatment than to another. So there's a little bit of trial and error too. Let's try this injection and see if it helps. If it does, great. If it doesn't, let's try this instead. There are some other medications we'll put them on sometimes too. I didn't list up there gabapentin to help nerve pain, but kind of the general treatment options. Any questions about necks? This horse right here, this is a myelogram. I didn't really touch on a myelogram. So myelogram, they do have to be anesthetized for a myelogram. That's where we inject contrast around the spinal canal so we can truly evaluate if there's any spinal cord impingement. We can guess based off of x-rays or guess based off of other things if there's impingement, but this is the only way to truly tell if there's impingement because it outlines where the spinal cord is. So we inject contrast around this into the spinal canal, then take x-rays, and this is a CT scan of a myelogram, and that's your main diagnostic. If you have a neurologic horse that you think the neurologic deficits are coming from the neck, that's what we recommend to diagnose it. Sometimes there's surgical options for those horses, sometimes not. But that's what that picture is. So back pain. This is a tough one. This is a tough one because it's a little bit tough to diagnose, and you can have primary back pain, you can have secondary back pain. Secondary back pain is relatively common, I think, from horses that have hind end lameness. So they start limping in their hind leg, they change how they carry themselves to compensate, and now their back hurts. People have this happen to them all the time as well. Your knee hurts and then later your back hurts. It's not because you have a primary back pain, but if you can fix the knee, that'll help the back pain. But you can have primary back pathology too. The difficulty in horses is that they're so big. We're limited on our diagnostics. Someday we'll be able to do a CT of their back and we will learn so much more. Today's not that day. CTs just aren't big enough, powerful enough. We can't get them in it. Can't get enough power to get good scans to truly evaluate the pathology. We use ultrasound to look at backs too sometimes. But all these imaging modalities have their limitations and we're not getting the full story. So, different types of back pain or back pathology. Kissing spines, I'll get up on my soapbox for this one a little bit. Dana's going to nod her head because she hears this all the time from me. So I am of the opinion, and again, we don't have the research to prove this, but I'm of the opinion that kissing spines is likely relative to some other type of back pathology. I think a lot of the time, kissing spines is not primary back pathology by itself. It is secondary to something else. And it's a little bit of I don't want to say a red herring, because I do think that horses with kissing spines can have pain from their kissing spines. This is a horse that has kissing spines. This is my horse that has kissing spines. He's got bony change along these impingements. That can be painful. So I'm not trying to take that away, but I don't think kissing spines happen in isolation. And therefore, I think a lot of the surgery for kissing spines is not warranted. never say never. There are some horses that have had surgery for their kissing spines and are off doing great things, but I'm really slow to recommend a horse go to surgery for kissing spines because I think that there's probably other things going on. I think if we can treat their pain and manage them with physical therapy, I'm a big proponent of physical therapy for back pain in horses. And you can compare it to the human side as well. Same thing, like they try to avoid, and I'm not trying to, the pathology that people have is not the same as the pathology that horses have, but they try to avoid taking you to surgery too. If they can fix things with physical therapy, change the mechanics, you have better outcomes. So, I think a lot of these horses, if we can manage them other ways, they in the long run do better. So they can also have osteoarthritis. There's joints in their back as well. Like there's joints in the horse's neck. I mentioned they can have primary, secondary muscle soreness that is playing a role, and back pain can be a little bit of a downward spiral. You have back pain, the muscle spasm, the nerves get hypersensitive, and then they're more reactive to stimuli. And so they spasm more, the nerves get more inflamed, and then it just keeps on rolling. So, some of our treatments are to just kind of get a reset, get things back to normal, so then we can influence other things. Spondylosis, this is something that we're starting to recognize a little bit more in horses. Not every horse with spondylosis is going to be clinical for it. Spondylosis, this is an x-ray of a horse with spondylosis. So what we're looking at here is the bottom of the vertebrae, and there's bridging. Instead of having just nice clean spaces between each vertebrae, there is bridging between each one along the bottom. As you can imagine, that might influence some of horses' actual mobility, able to lift through their back. But this horse was not clinical for it. Just going back to kissing spines real quick too, there's a lot of horses that are not clinical for their kissing spines. And this is part of why I get on my soapbox about, I'm not sure, a lot of people like to make a big deal out of kissing spines, and I'm not sure that's always warranted. Because I think in a lot of cases it can be managed. So, this gets tough in a pre-purchase situation because people see kissing spines like, oh no, I'm going to have to fight this horse's back pain for the rest of my life, their life. And that's not always true. It could be, but going back to, we don't know what some of the underlying back pathology is there. I said, this is my horse. He's been great. I've treated his back a couple times, and he's done lots of things in his life. So it's not always a deal breaker. You have to look at, are they sore? Can I affect how they move? Can I change some things to make them use their back better and increase their core? So, there's a lot of parts to the back, and there's a lot that we just don't know that goes into it. So, to say every horse with kissing spines is, should be passed on and isn't usable, I don't think is entirely accurate. So going down, disc disease, I'm sure there's some horses that have disc disease. We don't know it. We can't diagnose it, but it would make sense that they do. Just looking at other species. Nerve root pain, I'm sure this is a problem in horses too. Whether that's secondary from arthritic changes, secondary to disc changes, there's a question mark there next to these two things because we don't know. We can't truly diagnose it yet. I'm sure it happens. So treatments, there's a lot of different treatment options for backs. So medical therapy, anti-inflammatories, muscle relaxers, different types of injections, mesotherapy. This is a picture of a horse that's had mesotherapy. If you're not familiar with what that is, when I was mentioning before, sometimes when we have muscle spasming and nerve inflammation or suspected nerve inflammation, we do treatments to kind of get a reset, get everything just back to status quo, back to normal. And that's what mesotherapy, the goal of that is too. We're injecting just into the skin, but we're treating a certain type of nerve fiber to try and get everything to essentially quiet down. Acupuncture, again, anytime you have nerve pain, I think acupuncture can be helpful. Shockwave therapy, I really like shockwave therapy for back pain. I think it can help a lot, but I think shockwave therapy can help nerve pain. Those hypersensitive nerves, I think shockwave therapy, we use it a lot for tendons and ligaments to help increase quality of healing, but I do think it can provide a pretty strong analgesic effect for nerve issues. Physical therapy, I think physical therapy is so important for horses with back pain. I don't think you can do these other treatments all day long, and if you don't change how the horse moves, don't address other aspects of the horse, whether that's hind end lameness that's contributing to their back pain, ulcers that's making them guard themselves and not use themselves. You're not treating everything else. If you're not getting these horses to lift their back, strengthen their core, you're going to just keep chasing that back. There's a lot of different ways the physical therapy can be done, and there's some good resources out there. This is a picture of a horse in a Equifit, I think is what it's called, system, walking over some cavaletti. So, walking over that cavaletti, when you watch a horse walk over cavaletti, they pick their back up. So just an example of that is not the only thing. There's other things out there, but if you have a horse with back pain, I really, really push the physical therapy side. I touched on surgery. I'm not a big proponent of it. I think you got to fix everything else. And even the surgeons that do surgery for backs push you to do the physical therapy. So I'm kind of try the physical therapy first, because maybe you can just fix it with that or maintain it with that. Any questions on backs? Yes.
I didn't see like massage or chiropractor on your list. Would that fall under physical therapy, or is that not something you would recommend?
So I feel like that's a little bit of a different conversation. So massage, absolutely. I think horses with sore muscles, your high performance horses, I shouldn't even say high performance, your performance horses in general have to be athletes for us, right? Like even, your easy riding horses are essentially a type of athlete. So I think massage can be very helpful. I personally am not educated enough about chiropractic to make a good comment about it. I am very nervous about chiropractic therapy and necks, because I think necks, depending on what your underlying pathology is in your neck, you can make things a whole lot worse. I think for a lot of horses, chiropractic therapy is essentially, some good massage with a little bit of manipulation, and it is kind of going along with the physical therapy. So I think that is a little bit of a correct statement. But I'm not trained in chiropractic therapy, so I don't think I can fully answer that question. I don't know if that helps. We have a couple of vets in our practice that are trained in chiropractic, and I would refer that question to them, just because, someone trained in that is going to be able to go more in depth into that type of discussion. Anyone else? Questions on backs? Muscle disorders. This, I think, is not as well known, but I think it needs to be, because I think there's a lot of horses with some underlying muscle disorders that we're not aware of. I'm doing a lot more muscle biopsies than I used to. It is less common. I say it's not well known. It is less common. Way more horses are going to have ulcers or back pain than a muscle disorder. But when you start ruling out, okay, we've scoped the horse, we've done a lameness exam, these things are checking out, and this horse still won't go forward. We've treated its back, we've done, X, Y, and Z, and we're still not getting anywhere with this horse, then a muscle disorder needs to be on the list. There's a lot of them out there. It very much, what I kind of think of depends on what breed we're looking at. Quarter horses have several. Most of the quarter horse muscle disorders can be diagnosed with a genetic test. So that is helpful. Not all of them. I have diagnosed quarter horses with PSSM type 2, which you can only diagnose from a muscle biopsy. PSSM type 1 is the one that can be diagnosed with genetic testing. But other breeds have other muscle disorders that we know. PSSM, MFM, warm bloods, Arabians have MFM. MFM is myofibrillar myopathy. It's a more newly recognized disorder. Dr. Valberg, who is the leading researcher in muscular diseases, she thinks that probably in the past, a lot of horses that were diagnosed with PSSM type 2 actually had MFM. But as we learn more, we know more and can come up with better diagnoses and better treatments. Clinical signs depends a little bit on the muscle disorder that they have, but a lot of these horses, the presenting complaint is they won't go forward, they're dull, they're resistant, or they're okay for a little bit and then they kind of hit a wall. The RER, recurrent equine rhabdomyolysis, and thoroughbreds, that's your typical horse that ties up. You think of your horse with the rock hard muscles that doesn't want to walk. But these other horses, their symptoms can be much more subtle. I use this picture because we have a draft horse, a quarter horse, and a thoroughbred. So you have your gamut of horses that can have muscle disorders. This website down here, I have it in the next slide as well. That's Dr. Valberg's website. There is a plethora of information on her website. And when I diagnose horses with a muscle disorder, this is where I direct them. I send them her information because it really is a fantastic website. Goes into the pathophysiology of each disorder, how it's diagnosed, how it's managed, what you should feed it, how you should exercise it, because that changes depending on your disorder. So a lot of these, like I mentioned, you have your genetic testing or you have to do a muscle biopsy. There's no easy, if you can't do a genetic test for it, you have to do a muscle biopsy. That sounds fairly invasive. It's really pretty quick and easy. We take just small little pieces. There's not much aftercare with a muscle biopsy. There's one suture, and I usually give them a day or two off and just go back to normal. The management of muscle disorders I kind of touched on. It's very, very dependent on which specific disorder. The diet recommendation for a PSSM horse is not the same as a diet recommendation for an MFM horse. So it really is very dependent, and I am not going into detail because you could have an entire talk about muscle disorders in horses. But if you have something you want to look more into, I really encourage you to go to Dr. Valberg's website because it really is great information. Any questions about muscle disorders? So moving on, respiratory issues. Respiratory issues can very much cause poor performance in horses in kind of a variety of ways. Start with equine asthma or inflammatory airway disease. Equine asthma, that name has gone through numerous changes over the years. Used to be COPD, used to be heaves. Now we're calling it equine asthma. So a lot of these horses will cough. Not all of them cough. Some of them just have more respiratory difficulty when you exercise them, so they don't recover well from exercise. It takes them a long time to return to kind of a normal baseline with their breathing. But a lot of them do cough. So to diagnose, we listen to them. Not every horse with asthma will sound abnormal when we listen to it. So, a lot of times we're like, oh yeah, their lungs sound great. Well, that doesn't mean your horse doesn't have airway disease. It means it's not severe, but you can't preclude that purely based off of listening to them. the best diagnostic for equine asthma is a BAL, bronchoalveolar lavage. So that's where we run a very long, skinny tube up their nose, into their trachea, down into their lungs, and we flush some fluid in and draw it back. So what we're trying to get is a sample of the cells in the airways. We send it to a lab who then tells us what the cells are, and what that population is, helps us diagnose this and some other issues. Radiographs can sometimes be helpful. This horse right here had pretty extreme inflammatory airway disease. We think it was secondary to an infection previously. We couldn't prove it. We tried really hard to prove it. But radiographs can sometimes be helpful. This horse didn't look that bad. Those lungs look awful. That horse clinically didn't look that bad. I was actually surprised when I started working that horse up how bad her lungs looked. Ultrasound can sometimes help too. Ultrasound looks at the surface of the lungs. It doesn't get deep into the lung tissue. So a lot of times we will recommend both if we're trying to evaluate a horse's respiratory tract, because radiographs and ultrasound gives a different type of information. So treatment of equine asthma or inflammatory airway disease largely consists of steroids to quiet down the inflammation, bronchodilators to open up the airways so they can move air easier. Antihistamines, I think, are sometimes helpful. Some of these horses are kind of allergy, they have an allergy component. A lot of them can't be managed or maintained with antihistamines alone, but a lot of times I'll use antihistamines to try and decrease the amount of steroid that I have to use. My big caveat at the bottom, some of these horses are show horses and you have to be careful about drug testing. When I have a horse that is a performance horse, I want people to tell me, when's your horse show? Because we will make a game plan so your horse can compete, but also so that you don't get a positive drug test. A lot of times we'll do systemic steroids. Obviously, systemic steroids can have systemic side effects. The biggest one we worry about is laminitis. So we do try to use inhalers or nebulizers, there's one right here, to try and focus our treatment to the lungs themselves. Root and Riddle has a great product for nebulizers that is a combination of 4 different drugs that I think is really helpful for when people have access to a nebulizer. But the treatment for these horses, like everything else, is a little bit individual dependent. So, when I am treating these horses, this is where we're going to start. We're going to play around and see what works best for this individual and also what works best for their expected performance. It's different if they're trail riding versus going out on a cross-country field. So lots of things to consider. Also for these horses, I don't have it up there, but we have to look at management too. Like I said, allergies can play a role in these horses. And so if we can alter their environment, whether that's wetting hay, getting them outside so they're away from the dust, or even just getting them outside when people are sweeping in the barns when we're kicking up dust so that they're not exposed to it. Changing their environment can help these horses a lot too, and help minimize the amount of medications we have to use. Any questions about, that's kind of a quick, yeah.
As far as horses with allergies and stuff like that, would you recommend doing like an allergy panel or anything like that to kind of like minimize?
Yeah. So sometimes, I think for some horses that's helpful. For some horses, it doesn't end up changing much, and not even because I think, if we can do anything to avoid having to use steroids or higher doses of steroids, I think that's great. So I will sometimes try allergy testing, and then either, because most of the time in horses, there's things in their environment we can't get rid of. You can't get rid of like dust in their environment. That's just not an option. So then treating with allergy shots, desensitization shots, can be helpful. That being said, I've had some horses where it made zero difference to them clinically. Probably if you tested their immune system, it made a difference, but to their clinical disease, it was not that helpful. So I do that sometimes. It's just not, it's not a cut and dry, always helpful situation. Any other questions? That was kind of a quick overview of asthma. Again, this could be a half of a talk by itself. So I'm kind of hitting the highlights here.
I have one question.
Yep.
If they are, like, we just got a new horse that came on allergy meds,
Mm-hmm.
like hydroxyzine, and how long, like, I've never had a horse with that, so, like, how long is it okay for them to be on that?
Well,
still coughing a little bit?
Yeah.
Still got runny eyes?
So that's a little bit of a loaded question because it depends on if you're showing them,
Yeah.
because you can't show on them, or you have to be careful about how you show on them. Sometimes you can do a med report form, but you still have to stop 24 hours out. So you have to be careful. A lot of allergy meds are fairly safe. So when you're looking at chronicity of treatment, yeah, I don't care if a horse is on allergy meds all the time. If their allergies seem to be seasonal, I'll try and just use them for the season and then stop them, because like anything else, if you don't have to give them something, then let's not. But that's not an easy question to answer, because it varies horse to horse. And sometimes too, they need, specific to your situation, if they are coming to a new environment, they might just need time to adjust to that new environment, for their immune system to adjust to that new environment. And then you can back off and they'll kind of go to normal. Other ones, it's all the time. So moving into respiratory, or another part of respiratory pathology, so functional issues. I think this is kind of a big one when we were looking at poor performance. If they have a mechanical issue that they truly cannot move enough air to perform, they're not going to perform well. So a lot of these horses will make noise. Some people will talk about, especially if they are speed event horses, race horses, your upper level event horses, they'll say, they just can't go, where they hit a wall, that they go so far and then they just can't anymore. I need to not move so much. So the things that we tend to think about, left laryngeal hemiplegia, so that's roaring. Dorsal displacement of the soft palate is another one. These things are routinely diagnosed by an endoscopic exam. So we take a scope, we run it up their nose, take a look, we can usually see. There are some horses that only show their pathology when they're working. So you can scope them at rest, standing in their stall, their airway looks fine, but they're still having issues when they're working. And so this horse right here is wearing a dynamic scope. So that is a scope that is made to be worn by the horse, so the horse can either be lunged, ridden, driven, whatever, so that we can see in real time what's happening with their airway. And I do have a couple of videos I'll show you in just a second. So for dorsal displacement of the soft palate, that's what this picture is. This is a normal airway. This is epiglottis, arytenoids, the opening of the trachea. This is the soft palate popped up over top of the epiglottis. So that's what that looks like. So the video will show, I have a normal video and then a video of left laryngeal hemiplegia. So you'll see that in the next slide. For treatment of these, there's a few medical things that we'll try. Some horses need surgery though, for true mechanical issues if we can't fix it medically. Especially for laryngeal hemiplegia, there's not many medical options for that. If your horse truly can't do its job because of its laryngeal hemiplegia, it's surgery, or it needs to do a not so strenuous job. There's not great answers there. There's more medical options for displaced soft palate, but some of those horses need surgery too. All right, so now we get to see if my videos play. So this one is a normal. If you get car sick, maybe don't watch. So looking at the arytenoids here, they're moving out of the way of the airway. So there's a nice big opening to the trachea. I'll play it one more time. So the horse can move a lot of air. And this doesn't usually bother horses, or that's a normal. The left laryngeal hemiplasia doesn't usually bother horses that have slower jobs. So like a hunter, they can do their job just fine with that airway. But if you get impingement of that airway for a horse that's trying to event, that's trying to race, they truly need as much oxygen as they can get. And you impinge on their airway and they just can't do their job. So this other video is an abnormal one. So you can see this side works, this side's moving, this side is not. And you can see how much smaller the opening to that airway is and how that might influence a horse that it needs to work at speed. I'll play it one more time. These videos are courtesy of Dr. Allison back there. But these are done with a dynamic scope. So that's all the motion that you're seeing is because the horse is working while this is happening. But that just helps us when, certain things are positional too. Some horses will displace their palate only when they're asked for flexion. Think your dressage horses or your saddle seat horses. And so we're not going to see that at rest. Any questions on mechanical issues? Yeah. Dr. Allison? Yeah. Yeah, it is a little bit, at a farm, yes, but it does have to be somewhere where we can work the horse. So no one's going to do it at my house unless we're riding the horse in my driveway because I don't have an arena. You have to have the facility to. Oh. Okay, there we go. So another thing, this is really more something we see for race horses. Again, horses at speed, race horses, barrel horses, we'll see it. Occasionally event horses, not often, is exercise-induced pulmonary hemorrhage. So bleeders, horses that bleed into their lungs while at work. As you can imagine, that's fairly irritating and going to influence their performance. They're not going to be able to work as hard or at speed if they are bleeding into their lungs. They're not going to move as much air that way. And also they're going to have quite a bit of airway inflammation. So diagnosis, certainly you just run a horse and they've got blood coming out of their nose. That's probably what happened, unless they hit their head on the way. Endoscopy, we'll scope them. Often what we see, we'll see blood in the trachea, blood in the nasal passageways. Some of these horses, it's hard to diagnose them unless you are right there when they are running and see them immediately after their race. So, if you come see me 5 days later and you're like, my horse didn't run real well, I think he might be a bleeder, but I didn't see blood. Well, I'm not likely to see much on a scope. So doing a BAL like we did for the asthma, doing bronchoalveolar lavage, you'll see evidence of blood in that. Sometimes radiographs will give us an inclination. A lot of horses that bleed have some consolidation in the very back part of their lungs. Treatments are generally Lasix. I think some horses that tend to bleed also have underlying inflammatory airway disease that makes them more prone to bleeding. And then on the flip side, blood very much can be in their lungs can be irritating. So some of these horses too, I'll treat them for inflammatory airway disease because I think it can minimize how much they bleed, minimize how much Lasix they need. Any questions about bleeders? No. Yeah, that's a good point. For both for both asthma and bleeders, there is some work that is going on looking at shockwave therapy being a really viable option for these horses, which is a little bit mind-boggling to me, how that changes, but there is some positive effects seen from shockwaving lungs in horses.
So you literally apply the shockwave. Like,
Yep, we shockwave their lungs in between each rib, go through. Yeah, yeah. I've done one for asthma. To be honest, I'm not sure how it's doing, so I can't really report. Have you done many? Any?
No, Dr. Phil Whitaker was doing a lot with their oral for EIPH.
Yeah.
Success. And then for the equine asthma, it's where the BAL comes in, where you have to.
Right, because it depends on.
Is it allergic or is it inflammatory?
Yeah.
And that also plays a role in how you treat, but especially from a testing standpoint.
Yeah, and that's a good point because you can have different cell populations with that BL, and I didn't go into that in depth about different types of inflammatory cells. And what they are seeing with the shockwave therapy is horses that have more neutrophilic type inflammation will respond well to the shockwave, but if they have eosinophilic or mast cell type inflammation, they do not. So, if you know what your cell population is, that does help you treat it a little bit more specifically. Anyone else? So less common, but very much can influence performance would be cardiac abnormalities. These we can at least usually get an idea of just by listening to them. Murmurs, the biggest question and the hardest question to answer, okay, I can hear a horse has a murmur. How significant is that? There's a lot of animals, people that have murmurs that are not a big deal for that individual, that they can go along, live their life just fine. They're fine. It doesn't really influence their cardiac output. But sometimes it can. Sometimes it can be a problem if they're, I say a big enough murmur, meaning from a physiologic standpoint, not a noise standpoint, because sometimes the smallest murmurs or the smallest pathology make the biggest noise. But if you have a lot of backflow in a valve, that is going to affect the horse's cardiac output. So that is a big question. And I hate if I'm listening to a horse, especially in a pre-purchase situation, and, I hear a little bit of a murmur, like, oh, well, okay, now we have to decide how important this is. Arrhythmias, that is probably the second most common thing that we see in horses from a cardiac standpoint, affecting performance. Atrial fibrillation being the by far most common one. AFib is pretty common in people, so most people have heard of it, but it is something we see somewhat, I shouldn't say commonly, but of the heart issues we see in horses, it's a more common thing that we run into. There is some treatment for it. Some horses can't be successfully treated or converted. Then that becomes a question of how safe is this horse to ride? Because even though they can go along just fine, they are at higher risk for an acute cardiac event as well. So, that turns into a whole conversation about, rider safety as well. Cardiology consults are super helpful for these horses because you have to look deeper to know, especially for a murmur, is this pathological or is it incidental? And you don't know by listening. So doing an echocardiogram, that's what this is, an ultrasound of the heart. They can actually look and measure things and, see how big of a deal where is this murmur coming from? How big of a deal is it? Is this horse fine to go on and do its job? Or is this something that we really need to be concerned about? We do an EKG. That's what this is. This is a horse with AFib. Often what that looks like. The classic description of AFib is it's irregularly irregular. So when you listen to a heart with AFib, the heartbeats are just all over the place. There is no rhyme or reason. You have your typical like lub dub with a horse's heartbeat, and it's just all over the place. And that's kind of what it looks like on the EKG too. It's all over the place. but a troponin, this right there, that is a blood test we look to help identify actual cardiac muscle damage. So it can sometimes be helpful when we're evaluating a horse for a cardiac issue. Cardiac issues in horses are much less common than other species, but we do run into them every once in a while. Any questions about heart stuff? It's a quick slide because we don't go into as much or we just don't see as much in horses. So I added just a miscellaneous slide. Some other things just to kind of keep in mind. We don't necessarily always relate to poor performance, but can influence performance. So PPID, so Cushing's, that can affect horses' muscling. It can affect their attitude and behavior. So if your horse is now dull and won't maintain a top line, and he's over 15, I'm gonna recommend you test him for Cushing's. So that can absolutely be a factor. Lyme disease. I think Lyme disease gets a little bit overdiagnosed along with EPM underneath it. But the hard part about those diseases is that they can kind of be very generic in their presentation. Lyme, we often will see hypersensitivity in horses. They're just very reactive and very sensitive to the touch. And that can be one-sided. It doesn't even have to be all over. Their left side is fine, but their right side, they just lose it if you go to touch their right side. So behavioral changes can be a symptom of Lyme disease as well. There's a blood test for Lyme disease that we do. I recommend the one at Cornell. Their blood test is a little bit more specific. So I think it is a little bit more helpful in diagnosing true infection versus just a sort of not a false positive, but an incidental positive, because horses, like for lots of other diseases, they can be exposed to things without being truly clinical for that disease. But it kind of turns into a catch-all because it can be a very generic looking presentation. If the horse isn't right, people want to test for Lyme disease, and it's a blood test, so it's a pretty non-invasive thing to do. So we do that a lot. EPM, that can certainly influence performance. The classic EPM horse is going to have neurologic deficits, but you can have some pretty subtle issues in a horse with EPM. EPM can look like a lot of different things. A classic presentation for EPM is muscle asymmetry. So certainly that can influence a horse under saddle. You can have really low-grade neurologic deficits where people are riding the horse and doing things. It's not falling down, but maybe it's tripping a little bit more than usual. Maybe it's just not as coordinated with its hind end. The canter quality is not as good as it used to be. So you can have some subtle things. I like Lyme disease. I think EPM kind of turns into a catch-all and is fairly overdiagnosed, mostly because lots of horses get exposed to EPM, so they will test positive on a blood test, but that doesn't mean they have the disease. To truly diagnose the disease, we should be doing CSF taps on all these horses, and that's pretty invasive, and not everyone is going to do a CSF tap, and I don't blame them. But that's how the conclusive way to diagnose EPM. So, a lot of people treat based off of suspicion and based off of a positive blood test, but it's a gray area for sure. For Dr. Allison, I will throw in there that eye changes can influence performance as well. I didn't really include anything in here because I think that's a whole separate discussion. But if you have a horse that has issues with their eyes, whether it's with their vision, whether it's glaucoma, so they have pain, whether it's uveitis, so they, again, a different type of pain, but they're having pain, they're not going to perform as well. They're not going to be happy to perform if they are having pain of any sorts. And, you should definitely include their eyes into that. So when you're looking for pain or looking for a reason why a horse doesn't want to perform, don't ignore the eyes either. But I think that is everything I have. questions. Yes.
If you have a horse that continually presents as if it has Cushing's,
Mm-hmm.
it tests negatively.
Mm-hmm.
Any thoughts on that?
Yeah. I see that sometimes. I treat them.
Like they have Cushing's.
I treat them like they have Cushing's. If they are giving me all the signs that they have Cushing's, enough of an index of suspicion, and I can't get them to test positive, I will still treat them. The tests are 80 to 90% sensitive. So that means you have 10 to 20% horses that have Cushing's that don't test positive. So if everything else about the horse is telling me they have Cushing's, I will still treat them. Sometimes I'll start at a lower dose to see how they change with the medication. You know, the Cushing's medication can cause inappetence, so I'll kind of ease into it if they're testing negative, or I have some that it's a really low positive and it's kind of a gray area. Those horses I'll often start at a little bit lower dose too, but most of those horses end up being treated with a normal dose because they respond positively to the medication. So yeah, that is very much a thing that happens. Yeah.
Sorry, we were late getting
Yeah.
stuck in traffic on the way. You were talking before with back injury.
Mm-hmm.
I have a PMU mare that's
Mhm.
now 18. When I got her, she was 6 weeks old, and I was able to finally adopt her. At 3 weeks old, we had seen her. The lady that adopted her had relied on all the paperwork at a day old. We put her in her basement, so we're
Jeez.
to get used to her. And we know the 3 times that she flipped over onto the cement floor.
Mhm.
So when I saw her, she turned her head, she hit the ground. My vet was furious when I originally got her. Said you just adopted an overgrown cat that runs into a really anymore.
Sure.
I'm able to ride her now. She went for like 6 years before I really started treating her. Long lining her to help with the back and stuff. She's 18 now. She still stalks like her back foot stuff, and she's bited her right side,
Mhm.
where the hip joint also is, to the back side, because I have a feeling that's where she's come down really hard.
Sure.
And I've noticed sometimes her buzz like low to the sensitivity, like you can see it peripherally. With the nerve damage, is there anything that I can put her on to?
So there's some things to try, and I that kind of presentation and what you described does make me think, okay, there's probably some like chronic nerve damage there that changes sort of the nerve function.
With the way the weather is, I can relate because I have
Sure.
myself.
Yeah.
Part of my doctor's should be walk that way.
Yeah.
And the only thing I take is the motion.
Mm-hmm.
But I wonder because I have them on. I used to have my horses on Floriflex and it worked great, but they just need to switch over to something else, and I now have her on that. So I'm just wondering something to kind of help.
So there's things that I try. There's no like great perfect treatment for nerve damage, and that goes for people too, as I'm sure you're well aware. I'll try gabapentin in them. Gabapentin, that it's for nerves. It's not a great drug. I think efficacy is shaky. And probably to get better efficacy for the nerves, we need to use higher doses, but higher doses will cause extreme lethargy. And so that's also then not tolerant as well. So I try it to see if it can help. And, chronic anti-inflammatories can help. So Equiox, Butte, things like that. Yeah.
I mean, to watch her on the field, she runs around like she's 3-year-old. So my idiot 31-year-old.
Yeah.
Which she pays for it the next day. But then I was just wondering if there's anything like something like the end of the
I think,
daily dose.
I mean, something like Equiox or, some people are using essentially it's human Lyrica in horses. It's a little more expensive, but it is a better version, sort of a newer generation of gabapentin. Yeah, I haven't used it much just because of the expense, and I've not priced it out anytime recently. But acupuncture, shockwave therapy, things like that might be, even though it's not a daily dose, a few treatments might help. Sure. Yeah. Percent. Presend. Presend is the brand, and there's another brand that recently came out. Is it Zygoglide or Zyoglide? It's something similar to that. But what those drugs are, it's Pergolide is the generic version. And I feel very strongly about not using compounded Pergolide. I forgot to go on my soapbox about not using compounded omeprazole too, but there are certain drugs that don't do well compounded, and Pergolide is one of them. It's a very sensitive drug. It doesn't stay good in just ambient temperature. So the Presend and the Zyoglide or whatever it's called that recently came out, they come in blister packs, and they're nitrogen filled blister packs to help maintain shelf life. So we are limited in our treatment options for Cushing's. Presend is the main one, or Pergolide. There is an injectable called cabergoline that I'll sometimes use in horses that don't respond well to Presend. I don't think it's the best option, but I think it's a decent option for horses that don't respond well to Pergolide. But some of the other stuff that people have tried over the years, the cyproheptadine, things like that, they just don't work very well. Sometimes horses need different doses of the Pergolide too, the Presend. I usually start them off at a pill a day for your average horse, but there are some that need 2 to 3, which gets expensive, but it's not a one size fits all dosing. Anyone else? All right. Thank you. Yeah.